Breast cancer is the second leading cause of cancer death in American women, exceeded only by lung cancer. But death rates have been declining over the last 2 decades, thanks in part to increased awareness and earlier detection. The OU Breast Institute hopes to bring even more improved outcomes for cancer patients, employing cutting-edge technology to help find tumors that otherwise might go undetected.
Breast cancer is one of the most common cancers among women. According to the American Cancer Society, more than 230,000 new cases of breast cancer were diagnosed last year, claiming the lives of nearly 40,000 women. That's why Dr. Elizabeth Jett of the OU Breast Institute is urging her patients to take advantage of new preventive technology. It's called breast tomosynthesis, a system that uses computer software to build a 3D view of the breast. Jett says in traditional 2D mammography, the breast tissue is compressed, making it difficult to detect a cancerous growth, particularly in women with dense breast tissue.
And so we can have tissue superimposed and we can obscure cancers so we don't see them when they're there. And we also have tissue that superimposes and can mimic cancer when it's not there.
For the patient, tomosynthesis is much like undergoing a conventional mammogram.
The only difference is that instead of the machine staying in one position and taking an image, it arcs. And depending which vendor, arcs over and takes several images, but it's still several seconds that we can acquire all the images that we need. So from the patient perspective, it's very, very similar to a typical mammogram.
It's kind of like taking a piece of bread out of a loaf of bread and looking at it one section at a time. It takes me about 8 to 10 minutes to do the test, and I've done this forever, about 26 years, so I'll take good care of you. I'm well practiced.
The Food and Drug Administration approved breast tomosynthesis 3 years ago. Subsequent research suggests the technology offers significant advantages over conventional mammograms.
And with the studies we have done, that we're finding more cancers. So in our traditional mammography, we might find 4 cancers per 1,000 patients. And in several of the studies we're doing, we're finding up to 7 cancers per 1,000 patients. And those were cancers we were previously missing.
According to the National Cancer Institute, traditional 2D mammograms miss about 20% of breast cancers. They also give a false positive about 10% of the time, which means women have to be called back for more testing. Jett says tomosynthesis has reduced those false positives by 40%.
So it's really a win-win at both ends. We're finding more cancers than we used to, and we have less false positives. We're calling back fewer people who don't have cancer.
There are some drawbacks to the technology. Because tomosynthesis is so new, insurance companies may not cover it, requiring patients to pay for the procedure out of their own pocket. But Jett says the OU Breast Institute will not charge extra for 3D scans.
We're sort of pre-screening patients, and we're looking for patients who either have dense breast tissue or at high risk, and we're offering tomosynthesis to those women. We will also provide it for anybody who comes in and asks us for it. And currently we are billing the insurance for it, and if your insurance pays us, that's great, and if not, there's no additional charge to the patient.
A more serious concern is increased exposure to radiation. Women who get 3D imaging also undergo a standard 2D mammogram, so they're exposed to twice as much radiation, which is a known cause of breast cancer. Jett concedes radiation doses are higher than with conventional mammograms, but says they're still within FDA limits.
What we are looking in the future is finding a way to take the tomosynthesis data and make a synthetic mammogram, and the technology is very, very, very close. So I think that it's a short period of time that we're going to be doing a combined study, and then we'll actually have tomosynthesis with lower radiation doses than what we have done in the past.
Even with the increased radiation, Jett believes tomosynthesis has proved its value.
Second day we started doing this, we found a cancer that, I look at the regular mammogram first, and I said I would have called this normal, and we found a cancer, and it was about a 2-centimeter cancer. And so I bet we have double-digit cancers that we have found over the last 15 months or so that we would not have found otherwise.
Jett says conventional mammography still works well for women with relatively fatty breast tissue, but believes tomosynthesis will become more popular as the technology advances, providing increased sensitivity to detect cancer and less radiation for patients.